morning, everyone. Welcome to our November Borough Cabinet meeting. My name is Brittany Scott, and I'm the Deputy Chief of Staff to Queensborough President Donovan Richards Jr. Unfortunately, he could not join us today, but he sends his well wishes and thanks everyone for attending. I want to personally thank our district managers and agency representatives who are with us this morning. Today, we will receive a presentation from the U.S. Census Bureau and the New York State of Health. Our first presentation will be from the U.S. Census Bureau. We are pleased to be joined by Joli Golden, who is the Data Dissemination Specialist at the U.S. Census Bureau. Joli will give us a look at some tools for diving into free census data. This presentation will be an introduction to how census data can be accessed to help community boards make more informed database decisions. Joli will also do a short exercise to access your local census narrative profile. Thank you, Joli, for joining us. You may begin your presentation.
Okay, thank you, everyone. So, who here helped get out the count in 2020? Anyone? Raise your hand. Be proud, be proud. Thank you for helping us to get a complete and accurate count for the 2020 census. We are still releasing data from that census, and we'll actually look at some of it here. But I'm thrilled to be here with you. I am one of 35 data dissemination specialists across the country. In 2020, I was one of 1,500 partnership specialist staff. I serve all of New York City, and including all of you. I help provide free census data access. I mean, it's free. You can access it anytime you want. But I work with community boards. I work with nonprofits. I work with editorial staff at CNN, and the list goes on, to help people better get a grasp on the census data that is available, to answer those questions, whether they be for grant applications or whether they be to answer to the public for why is something happening in this area, or why are we putting this development here, or why are we putting this wraparound hub for services over there. There are many questions that can be answered, and we don't need to guess, right? Because we can make database decisions with the information that we're collecting every year, let alone every 10 years. In case you were looking to find webinars or we have little data gem videos. If there are things, I might show you a few things. I'm happy to come and be a guest at your community board meeting. I was just at CB11 in Harlem the other night. Even sometimes to do a session that's a little longer with key committee members who might be interested in accessing data but are having a hard time finding it. So this is census.gov/academy for those resources. So in my short presentation today, we'll cover some popular surveys, data access, data profile tables, a little bit about geography, because the backbone of finding census data relies upon geography. And we'll do an interactive exercise where you access a census narrative profile, and I'll show you a little bit of data.census.gov. Everyone in? Okay. So a little bit about the Census Bureau. We actually don't just work every 10 years. Even though the decennial census is our largest operation, it's the largest peacetime operation of the government. We are the largest of 17 statistical agencies. And we work in collaboration often with other agencies. So we may, because we have that field staff in place, and also we are constantly hiring. That's another thing to know. On usajobs.gov is where you can find those jobs. So we do the decennial census. We're also known for the American Community Survey, which we'll go over in a second. The economic census, we just finished collecting data from millions of businesses. That will come out next year. That happens every 5 years, ending in 2 and 7. So we just collected the 2022 data. And our job is to serve as the nation's leading provider of quality data about its people and economy. So in terms of the decennial census, does anyone remember there was a number that we all used to say? It was X billion dollars that is distributed based on census data numbers. Well, now it's $2.8 trillion. So in terms of the importance of collecting accurate information, it's really important. And what happened in New York after 2020? How many seats did we have? We gained or lost a seat? Lost a seat, right? And after that primary, Carolyn Maloney was out of a job. That's what happened after 2020. New York population has been declining a bit, but frankly, it was a tremendous effort, and most people were glad that we only lost one seat. Census data also defines legislative districts, school districts, and much more is relied upon using that data. In 2000, we stopped distributing the long form of the census. It used to be some people would get a one-page questionnaire for the decennial census, and some people would get an 8-page questionnaire. So in order to collect more ongoing data, data on an annual basis, we shifted that collection process and created the American Community Survey, where we asked questions, 72 questions over 35 topics. It's a treasure trove of information, and we release that information twice a year in September and December. So there's 1-year data and 5-year data. This becomes more important when you go to look for data. If you're looking at the county level, in Queens, you can get 1 year or 5 year. If you wanted to look at the census tract level, like an area where there were 4,000 to 10,000 people living, you'd be looking at 5-year data. So it's just something important to know when you want the most accurate recent data. So this nice diagram shows you a little bit about what geographies are available and how they nest. 2 things to know: when you're looking for census data, place is city. So if you're looking for city in our search, you're looking for place. And we call zip code tabulation areas. So those are just 2 things to know. But if you look down, you can see that we go from the nation to the states to the counties. All of those nest neatly within one another. They're each part of one another, down to the block groups and the blocks. Sometimes people want to know, how much data can I get from my block? Well, for privacy reasons, we release very little data at the block level. So usually you're looking at the census tract level. And we also, our data, it's protected by Congress, it's protected by law, that we need to make sure that people cannot be identified based upon the data we release. And now we do something called differential privacy, where we sort of insert a little bit of noise information to some of that data. And if you wanted to know, so what kind of data do you have? What can I find in the American Community Survey? These are all of the topics, and they range from disability to income to home value and many more. And I listed that we'll distribute the presentation after, but when we look in that data.census.gov, which is the bedrock of information of census data, these table numbers, DPO2, DPO3, those are easy ways to access a lot of data at once. So just to give some ideas, I pulled a little bit of data for Queens and just did some simple bar graphs in Excel. This shows gross rent as a percentage of household income, 35% or more. So this is by percentage, and this comes from the comparative housing characteristics table. So you can see that the range of gross rent as a percentage of household income, 35% or more, ranged from about 47% of the population in 2017 to 43% in 2022. New York is expensive. New York City is very expensive. And this obviously just illustrates some of what you're seeing in the news about housing crisis and what's happening as less people own their homes and more people rent, and how much of their income is being taken up by that rent. This gives us so we can also map the data, which is amazing. This shows a map of the 5 boroughs, and that gross rent is a percentage of household income, where it's more prevalent that people are paying 35% or more of their income in rent. I have to say the Bronx wins, unfortunately, followed by Staten Island, and then Brooklyn and Queens are at a similar level. But it's this just gives you a sense of how you can map data related to other counties, related to other census tracts. And now moving to something a little different, we recently released detailed data based on racial ethnicity groups from the 2020 census. There's a way, this shows you, we currently, and for a long time in the past, we asked about Hispanic, Latino, and Spanish origin separate from race. So this was the question on the 2020 census for Hispanic, Latino, or Spanish origin, and you see on the bottom that you could fill in something, and the same thing for race. So recently we released something called the DHCA, Demographic Housing Characteristics File A, and that gives us a look into what people filled in on the census and what they checked off. So I pulled just a little bit of data from table T01001, and I'm saying these table numbers partly because if you find a table that you like, it's good to jot down the number because it makes it really easy to pull that data back up. You can also copy the URL once you find the table and email it to, these are all embedded in here. So it was interesting to see what a tremendous South American population self-identifies in the borough. Caribbean Hispanic population, over 200,000 people. This is in this borough. The Ecuadorian population was larger than in other neighboring boroughs at about 125,000. So as we know, Queens is one of the most diverse places on the planet. Like, it is incredible in terms of diversity. And what the data can show is a little bit of where some of those racial groups are living, and other characteristics based on race. We did a data visualization about this race and ethnicity, and we did it by where you can pull it up by ranking. So this is Queens County. I know, I'm sorry, this typeface is really small. You probably could see it in your handout. But if you look here, I just pulled the detailed Asian alone or in any combination groups in Queens County, and they're listed by the breakdown. So you can see that 277,000 identified as Chinese, except Taiwanese, moving down, Asian, Indian, the Bangladeshi population at over 60,000, and so on, moving on down, and you can do that for other races as well. So this is a visualization. It's an interactive tool, but different than the other tools we'll look at. So, all right. Okay, so since everyone's probably tired of hearing me talk at you, let's do something fun. So we're going to look at the census narrative profile for your home or work address. I'll do it up on the screen. You can do it here at the table. You can use your phone if you want. You can use your computer, whatever, your tablet, whatever you've got. Hold on. And so, I know this is the fun part. So if you look up census narrative profile in Google, or I'm going to show you this fun trick where I have it pulled up in Chrome, and I'm going to generate a QR code. So if you wanted to scan the QR code up on the screen, either way.
That works for me.
It works for you. All right, so if you got there, which hopefully you did, and just know that anyone can generate that fancy QR code. It's not hard. So here I am on the census narrative profile page on your phone. You'll see it too. And there's, for 2021, we reduced something called we introduced an address lookup. So you can actually put your address right where it says address lookup, or do you see it on your, anyone see it on their phone? Mm-hmm. Okay, so you can put your address in there. You don't even need to put the zip code usually, and hit enter. And I'm going to do it here for, it gives you a box to put it in, 120-55 Queens Boulevard, Jamaica, New York. And I just am going to click on lookup address. So when I click on lookup address, it found a match, and it shows me that I can look at the narrative profile for all of these different geographies. I can look at it for New York City, I can look for the zip code, and I can look for the census tract. So census tract is the smallest data that I can see from this. This is one tool, but if you said, I'm thinking of moving to this neighborhood and the house that I'm looking at is in this place, or the office I'm looking at is this place, you could pull up this narrative profile and it shows you a 5-year estimate of data from the American Community Survey, and it really hits the most often, it may be loading, oh it's loading, it hits the most often searched for data, and you can see it in bar graphs or tabular format, and there's some narrative there too. So you can see what the poverty level is, how people commute to work, whether people speak English at home. Oh, well that's not what I like to see, hold on. I don't know, it didn't like I had it pulled up before, let's see if I pulled it up here. Oh, you know what, I pulled it up in the presentation, hold on. Was anyone able to find their address? Mm-hmm. It came up? Yes. And now you're just looking and seeing all of what's happening in your neighborhood or in your business area? So this is what it will look like when it pulls up, and you'll see all these. I happen to pull up the commuting to work. We recently started asking about whether people work at home, so that whether people work at home data figures into our statistics. So you can see here that in this immediate area where Queensboro Hall is, that 55.5% of people take public transportation to work. And 19.7% work from home. So one thing that community boards often ask me about that I can tell you that I can't track down is how many people commute into your area and park there or bring vehicles into your area. We can do it by, I think by state, but we can't do it down at the community board level. So, okay, that was our interactive piece. But don't worry, you can keep looking at other things if you want while I'm showing you stuff. So just to give you a sense of how deeply you can go and how easy it is to find census data about your local area, we're going to look at the top 25 census tracts in Queens County with the highest population of kids enrolled K to 12 in public school in 2021. And then we're going to look at that data, at that map, and we're going to put the boundaries of what's called the public use microdata area, and that shows pretty much community board boundaries. So you'll be able to get a sense of the kind of data that you could find at a smaller level than your community board, but that's within your district. So I'm going to go to data.census.gov. Anyone who wants to type along, go ahead. So it's pretty straightforward. This is your general search. If you put in Queens County, you know, we could put in Queens County, and a bunch of things come up, and I'm going to just pick Queens County. And the thing with the general search is, it's general. It's like searching Google. So sometimes, here we go, 3,421 tables came up. So this is where you could shop for data right here. There's the race table. There's a really nice county profile, which will pull up a lot of information about the county and then the county borough, and then it'll pull up this information, and then you can click on any of the links that come up. So while that's loading, I'm going to take us back to here, and I'm going to click on Advanced Search, and this is your nav bar on the left. We're going to pick the smallest geography we're looking for. So sometimes you think, oh, Queens County, I'm looking for tracts in Queens County. We're going to click tracts and then go and find Queens County from here. So Queens County's in New York. And while I'm going to make this all look very easy, which it is, it does take a little practice, and which is why I'm always happy to come to the community boards and show people how to find the data. On here on the left, we'll pick 2021. That's the most recently released data at the tract level. And our topic, and we could look up anything. We could look up SNAP benefits. We could look up house value, housing information. But we're going to look at education and school enrollment. I was looking at across the city what's happening, you know, where people are enrolled, where kids are enrolled in nursery schools, since that's been a very interesting topic lately about whether 3K and pre-K, what's going to happen with 3K funding. So here are my results. So now instead of 3,000 tables, I got 24 tables. And I can click on any of these and open them up. And now you think, Joli, what's going on? You said we could find this data. Well, this is actually a friendly stop sign. And I'm just going to click open the table. And we'll give it a minute to load. And now 700 tracts, over 700 tracts in Queens County have loaded, right? Just like that. And because even though we all love a giant spreadsheet with, you know, thousands of columns, we're going to map the data. And I am no artist, right? This is not, art is not my, I'm an art appreciator, but I am, I can't draw, but I can make this map in 2 seconds. So here's my map, right? With all of the, and I'm gonna make it a little bigger so I can zoom in. And this shows me, this is a thematic map. So it's showing me where the population is more concentrated. That's 3 years and over enrolled in school. But I want K to 12, so I can select different variables. And just like that, my map repopulates. And then I said that we would also, and I could go by percent. I could do public school or private school. But then, I'm back, we're back. Always, you can always hit the back button. I can change the color of the map. Pick your favorite color, and how opaque it is. And then what's really cool, I think, especially for this meeting, is I can click on this boundary tab, and I could add congressional districts. I could add state legislative districts. I'm going to add public use microdata area. And now, what we can see is, we can zoom in and we can see different areas of Queens where with the percent of population that's enrolled in public school, if I wanted to know more. So in track 365, 96.8% is enrolled in public school from K to 12. But then let's say I wanted to get a sense of those numbers. I'm going to click on number, and number of kids, students in public school. And these darker tracks will show you, like, just in that one small area, there are 1,889 kids who are enrolled in K to 12. So if you were looking at doing programs or providing services that catered more to a population with a lot of families with children, you could look at that. I could also go and look at that data and see what the income levels are, what the, how many single household or families there are, and more. So this is just one example that shows you how you can look at census data and manipulate it from the American Community Survey. Does anyone have any questions? I think I've used up my 15 minutes. So I'm going to go back to the PowerPoint.
Before we begin, I want to remind everyone to please speak into the microphone once we begin our Q&A. My colleague Khalil Brad will provide you with the mic once you raise your hand for a question.
And this is an example of where there are more households receiving SNAP in the Borough of Queens. So that's what I have to share with you today. Would you like a mic?
Thank you, so I came a little late, I'm sorry for it. So I represent Community Board 4, which is Corona and Elmhurst. And this is a community that has a very large undocumented population. As a result of that, my census numbers were strikingly low this year. When I say I dare 6 years back, this also happened during COVID, so our numbers were very, very, very low. Turns out the majority of the households, after we did our own survey, the households did not fill out the surveys because they never received them. And the question is, how did that happen? It happens to be that the landlord that lived on the first floor didn't want people in the basements and the attics to be counted. So we ended with a low number. During our last budget consultations, I asked a very pressing question to the NYPD specifically as to how much of the census data do they use to allocate police officers, and they said a very large number. And while it's good to know, it's also disappointing because there's a huge differential that's just not being considered. I want to know, I understand that I came in a little late, we said the census continues to go year out. But what happens now when I have an enormous large number of population that's not being counted and resources are heavily dependent on these numbers?
So there are a couple things that happen. We not only do the decennial census, but then annually we do our population estimates, which are also relied on for funding, and that relies on mostly on administrative data, so that's birth, death, and migration data. So those numbers do get adjusted each year. There may be some reliance on the decennial data. We constantly are looking at how we can better count historically undercounted populations and hard to count populations. The undocumented community is a hard to count community. And as we know, the 2020 census was especially challenging, partly due to COVID, due to the proposed citizenship question, but and there was a post-enumeration survey as well that looked at how effective the count was. So in terms of numbers being adjusted, those population estimates do adjust the numbers, but in terms of that complete and accurate count, we do a tremendous amount of partnership. I know we had people out in Corona, but I can get back to you on how, if you give me your information or card, how what efforts may have taken place after the count.
Okay, thank you. Thank you. And if I may just follow up with a second really quickly, I think I speak on behalf of all the DMs. When we go to our websites, the district profile that we have there, I don't know if it's maybe a marriage that has to be done between city planning and the census, but our district profile is still dated 2010. And exactly, and again, you know, we've been operating on these for a while, and it's not something we can generate. And I'd love to show you what it looks like, because I'm looking right now, mine is about a 15-page long document. It has every school, basically what you just showed up here is here on this. So I want to know when that marriage would happen and how to get that to work.
So in terms of, our data will be, what the website I showed you will be the most up-to-date place, because that is where we release the data. Many other city agencies and organizations like city planning will pull from that data using APIs and other bridges to access it. But when you look at something like Population Fact Finder, we'll release 2022 numbers that would be at the tract level starting in, I believe it's December 10th. December 7th or 10th are coming out. You won't find them on Population Fact Finder probably for another 6 months. But we make the data accessible and the tables accessible, and then it's the city that's providing that profile. And I can tell you that in terms of the school numbers and the school district numbers, New York City, when we look at New York City, it is one large school district. It is, as we know, mayoral control, it is one school district. You don't see the granularity that you see in other places, but obviously New York City DOE has that information, and they're probably feeding it in. So I can't tell you why the city may not have updated that portal yet, but I can tell you that the 2020 data is out.
All right, so maybe something we can talk about is DMs, and maybe have the Borough President's Office assist with updating it, because we're operating on 13-year numbers. Thank you.
Any more questions?
Well, thank you very much. I look forward to hearing from some of you. I'm happy to come and speak with your community and to show the same kind of, if you had specific topics that were of interest to you, just like I pulled those graphs, those bar graphs for Queens County, I can pull them in smaller areas as well. So I appreciate your time. Thank you.
What's your contact information? You have contact?
Sure. My contact information is up here. I'll send it, Khalil will send it, I will send you send the presentation, it's at the end of the presentation. My email address is joli.r, as in Robin, .golden, GOLDEN, at census.gov, census.gov.
I understand some of the words I wanted to make out on the printout, so I'll email the presentation as well.
Thank you, Joli. For our second agenda item, we will receive a presentation from the New York State of Health. This morning, we will hear about the upcoming open enrollment for health insurance coverage in New York. We will also discuss the ongoing public health emergency, Unwi, and what New Yorkers need to be aware of in order to prepare for a seamless renewal of their health coverage. Here to present on behalf of the New York State of Health, Stana Nackley. Thank you for joining us today. You may begin.
Thank you so much for having me. Hello, good morning, everyone. My name is Stana Nackley, and I'm the New York City Director of Outreach and Community Affairs for New York State of Health. And I will talk to you today about what New York State of Health is just in general, what our mission is, how we function, who is eligible for coverage, and then turn a page a little and talk about the very pressing matter of end of public health emergency and renewals for health coverage and how we can work together, hopefully. So just kind of as a way of background, I'm going to assume that most of you have heard about New York State of Health, but just in case you haven't, we'll cover what New York State of Health is, what the programs are that we have, and how people can enroll and who is eligible. We have some financial assistance available, so I'll touch on that. Talk about open enrollment and some resources and tools that we have for consumers, and then the renewal of health insurance coverage that's currently ongoing. So just background, New York State of Health is basically came about as a result of the Affordable Care Act passage in 2013. Sometimes people also call it Obamacare. And the idea behind it was federal government basically allowed states to build their health insurance marketplaces if they so chose. Some states decided to build their own. Some states let the federal government run the marketplace, like New Jersey is run by the federal government. New York State decided to build our own marketplace. We call it New York State of Health, and it's run by the Department of Health, the State Department of Health, who I work for. And basically the marketplace is there for consumers in New York's entire state to kind of look for health insurance in an easy way. Sort of like Expedia for health insurance. You can go and look for plans online by zip code, see exactly what's available to you. You can compare those plans side by side, see how much they cost, what they cover, with the goal of hopefully finding a coverage that's right for you. And then you can also enroll online as well. The programs that we cover are Medicaid, which they go by income levels. So Medicaid is the lowest income level program. About that is Essential Plan. It's a really wonderful plan that only few states in the US offer, and it's basically above the Medicaid levels, but still quite low income consumers. And then we have Qualified Health Plans, which basically is your standard health insurance available with tax credits to help you pay for the premiums if you qualify. And then we have Child Health Plus, which is a really wonderful program. It's available to children, all the children, regardless of immigration status. So the open enrollment usually takes place in the fall, always November through January. So the open enrollment officially will begin November 16th. And if consumers want to enroll in coverage for January, they need to come into the marketplace and complete their application by December 15th deadline. However, because we had the COVID-19 public health emergency, we kind of had this ongoing open enrollment for the last 3 years. So basically, anyone could come at any time during these past 3 years and enroll in health insurance coverage, regardless of the open enrollment that usually took place in the fall. So it was kind of an ongoing open enrollment. And the public health insurance programs, which is the Medicaid, Child Health Plus, and Essential Plan, have a year-round open enrollment period, which basically means if you're eligible for those programs and their eligibility is based on your income and household size, then you can come and enroll at any time. So some important dates. The way New York State of Health works is on the 15th of the month basis. So basically, if you enroll by the 15th of the month, so today is the 14th. So if I enroll today, November 14th, I would have coverage starting December 1st, which is pretty great. New York State of Health is one of the newest developed programs, so it's quite modern and works faster than other things work, which is wonderful. So you can come to our website, you can do the application today, and immediately we'll tell you what you're eligible for within minutes after you finish the application, and then you can enroll immediately and choose a plan that you want. So it's really great. So 15th of the month, kind of ongoing basis. So next month, if you enroll by the December 16th, your coverage would begin. Next month would be, yes, December 16th, and then coverage begins February 1st, and so on and so forth. So what is covered? So this is another great thing about the Affordable Care Act. Basically, the idea was to make health insurance more standardized so people could easily understand what actually the plans cover. Prior to that, you couldn't really tell. Every plan was different. There was no standardization of any kind. Now, all the standard health insurance plans cover the same benefits if they're a standard plan. And there's these 10 what we call essential health benefit categories that every standard plan now covers. So some things that previously weren't included in health insurance plans, like for example, substance health or prescription drugs, are now covered under every standard plan. So it's easily comparable. You can compare plans side by side and see how they differ much easier than it used to be. Also, the preventive care is free of cost. There is no co-pays or anything, so everybody can go and do their wellness care every year and should. And there is no any extra charge for that. So here's kind of this is a little complicated chart, and but it's out there. You can look this up later. But it basically shows you the different eligibility levels for the different programs that we have and who is eligible for what based on income. So as I mentioned, Medicaid is for the lower income consumers, then followed up by essential plan, and we have 4 different levels of the essential plan that goes up to 200% of the federal poverty level, and then above that up to 400% of federal poverty level plus we have the tax credits. So for example, actually let me just show you this chart, it's a little better to follow with numbers. So if you are a household of 1 making up to $20,121 a year, you would be eligible for Medicaid. If you are a household of 4 making up to $60,000 a year, you would be eligible for the essential plan. Both of those are free of cost. So Medicaid has no cost, it's free, and so is essential plan, also free. And then above that, up to 400% of federal poverty level, which right now for a family of 4 is $120,000, is where we have the tax credits available. So up to the level, anyone that is within that income range would be able to get a tax credit that basically helps them pay for the health insurance premiums. The way the tax credit works is on a sliding scale, so the larger the income, the lower the tax credit, the lower the income, the more the tax credit would be. And then you can decide how you apply the tax credit, whether you want to sparse it out every month or yearly, or when you reconcile your taxes, there's different ways to use it. But it basically helps you pay for the health insurance premiums. So another way that the Affordable Care Act kind of changed how the health insurance works is basically there are many ways people can now access health insurance and enroll. The easiest way, if you feel comfortable with technology, you can do it online yourself. You just create an account, username, password, and go through the entire process yourself online. You'll be asked about information about your household. Every member in your household will ask about income, where you work, things of that nature, and then immediately after you complete the application, you'll see what every member of your household is eligible for. You can also call the customer call center we have. They're open 6 days a week, Monday through Saturdays. They speak many, many languages. I think we have around 500 representatives speaking multiple languages right there. If they don't speak the language you need, we connect you with the interpreter, so any language possibly calling will get an assistance, and they can do the entire application for you over the phone. And then lastly, we have enrollment assisters. We have about 5,000 of them across the state, in every county, in every neighborhood. They're basically certified by us, specialists in health insurance, and they're there to help you through the process. It's free of charge. Strongly recommend people take advantage of it. Health insurance is complicated, so why not take help if it's available. We have a really nice tool I'll show you in a minute where you can look up assisters in your area, connect with them, and they can do everything for you on your behalf. So some of the resources, so this is the assister tool. All you need to do is put your zip code in if you have a preferred language, and we'll show you a list of assisters in your neighborhood with their contact information, so you can reach out to them and they can basically enroll you and your family in coverage. Some other really great tools that we have available on our website, and we have tons of information available, is a plan lookup tool. So every area of New York State has different health insurance carriers and different plans available. They differ in the carrier availability, but also in price. New York City, so the 5 boroughs are considered one region for health insurance purposes. So the whole 5 boroughs will have the same plans available from the same carriers. So you just put your zip code in and it'll show you all the plans available to you, how much they cost, what they cover in a great detail, and then you'll be able to compare them side by side and see how they differ from one another. We also have the out-of-pocket cost estimator and the tax credit estimator. So before you even commit to enrolling, or you don't want to create an account, you're just kind of curious, you can go there and put your household size and income, and it'll show you what type of tax credit you may be eligible for as a family, like how much money you would be able to get to pay for the premiums. Okay, so now I'm going to switch gears. This is kind of really what we are focusing on right now and talk about the ending of public health emergency and what it means for New York City consumers, and how we are hoping that some of you may be able to assist us in educating consumers about the changes that are happening. So as a background, so in 2020, the federal government declared required basically states to keep the open enrollment continuous. So what that meant was everybody enrolled in public health insurance programs didn't have to do anything. They just stayed enrolled in the same thing that they were enrolling at the time continuously. So previously they would have to come in every year and renew their coverage, which basically means they would have to prove how much they're making, what their income is, where they're living, the household size. But because we were under the public health emergency due to COVID, we decided to kind of stop that requirement, and everyone was continuously enrolled in coverage. So that requirement had ended in May, and now we are kind of going through a process of renewal. So everyone is going to have to start renewing again. So this is a kind of a quick chart that shows you what the impact of this requirement of continuous coverage resulted in. So as of January, more than 9 million New Yorkers, which is about half of state's population, is enrolled in public health insurance programs. That's huge. And the increase in the enrollment in these programs during COVID was 2 million extra consumers that enrolled. So between 2020 and 2023, 2 extra million people enrolled in these programs. So right now we have actually over 9 million people enrolled in public health insurance programs. So for Queens specifically, now think about the number, 9 million people for the entire New York State. Out of those, it's 1.22417 in Queens only. That is really a large number of people that are enrolled in this public health insurance program. So Queens, along with Brooklyn and the Bronx, is where the largest number of people enrolled in public programs live. So what that means is basically all these people are now having to take action to retain their coverage. So starting this past spring, we started to send out the renewal notices to everyone to let them know that they will need to take action in order to keep their health insurance coverage. And this is a really huge undertaking because, you know, as we know, not everybody's always opening their mail or paying attention to what's coming to them. And sometimes they just don't do what they're supposed to do, and all of a sudden they go to the doctor and find out that they don't have health insurance no longer. So this is really, you know, a big project that we're working on, and we heavily rely on community partners and anyone that we can connect with, like you, that interacts with public and consumers to make sure that they try to kind of help us pass the information out to your consumers so they're informed and they know what to do. So basically, this whole unwind of the public health insurance programs is taking place over a year. So it started in past June, and it's going to go on until next June of 2024. So not everyone has the coverage starting at the same time. You know, people enroll in health insurance during different times of the year, so they will be also renewing their coverage during different time of the year. So it's over a whole year. So it's not like we do it all in 1 month. But it's still a really large undertaking. So consumers enrolling through New York State of Health, and majority of people in New York are enrolled through us, will get this renewal notice in mail. We try to make it really kind of catch people's attention with the red and, you know, it's time to renew, it's time to take action, so they wouldn't miss it. But we do send a number of notices, not just one. We send them, I believe, 6 or 7 notices. Some are over text, some are over email, some over physical mail, just to make sure that people actually see this and take action. So what can people do in order to prepare for these renewals? The most important thing to do is to update their information, which is their address, phone number, email, so we are able to keep in touch with them and know where to send communications to. Where people live also influences what they're eligible for. As I mentioned, there's different rating regions throughout the state. So if you move from say, Queens to Westchester, you would be eligible for something completely different in terms of health insurance access. So you must update your information. So the number of questions that usually come up that are most frequently asked is, you know, I haven't gotten the letter, what do I need to do? Was I supposed to get the letter? How can I find out? Well, the easiest thing to do is to contact us if you're enrolled through us. If you're enrolled another way, because some consumers are also enrolled through HRA in the city, they could contact them and they can find out when the renewal date is and when they need to take action. They can also log into their account if they have one online. They can call our customer call center and ask those questions. Same, if I don't know my renewal date, you can contact whoever you were enrolled through and ask them, when do I need to do this? How much time do I have? So basically, the most important thing is to know who you enrolled with, whether it's New York State of Health or HRA, and how you're enrolled. You can actually check yourself, but just make sure you don't miss the deadline for your renewals. So we have this really great dashboard that shows you how the renewals are going so far. So this one is as of September. Over 77% of consumers that had to renew took action and did it. So that's great, right? But that still leaves 23%. Yes, 23% of consumers that didn't do what they were supposed to do. So those people are basically not likely going to be without health insurance coverage because they didn't renew their coverage, which is what we do not want to happen. It's not, they can always come back and re-enroll, but they will then likely have a gap in coverage, and nobody wants to be without health insurance if you don't have to be, right? So this is kind of the statistics that show you the numbers of enrollees and when they renewed and through what channel. This is specifically, sorry about that, I don't know how that happened, but this shows you by county. So Queens is at 75%, so slightly lower than the state average of 77, but really good still, the rest of the 5 boroughs. So that's the end. This is our contact information, our phone number for our call center, our website. My information is not on this, but I'd be happy to share it if anybody has questions. What we are hoping to do is, and I think I may have already interacted with some of the community boards in Queens in past year, but we're looking for opportunities to spread the word, basically. So if there is a health fair, street fair, if there is a group of consumers that come to you, we are happy to come do workshops, trainings, talk about it. Just kind of want to make sure that people are aware and do what they're supposed to do and don't lose their health insurance coverage. So if there is anything, please do let me know. We would appreciate any opportunities like that. And I'm happy to answer any questions.
Thank you, Stana. Seeing no questions, I'd also like to acknowledge our representatives from FDNY, the Mayor's Office of Community Affairs, DDC, DOB, and DOT. I'd like to open the floor to them for any updates if they have. Seeing none.
Good morning. My name is Paul Lewis. I'm from DOB, Community Liaison, representing community boards 5, 6, 8, 10, 12, 13, 14. The update I have today is the periodic gas piping system, where people, residents of homes of 3 or more that have to do gas inspections in a cycle of years. So we got an update because of a recent issue that just came about. So this year's cycle will be covering subcycle D, that would be community boards 11, 12, 14, 15, and 17. So they have up until New Year's Eve 12/31/2023 to get the inspection done for their gas sprinkler system, or they'll receive a violation. The next cycle will be for cycle A, be for community boards 1, 3, and 10. I just dealt with an issue recently for condo apartments that are garden apartments that are grouped in the same zoning lot. I forgot the exact zoning lot. They have the same zoning lot, so they're basically townhouses, so it's 1 to 2 because they're grouped in the same zoning lot. Our system is putting them in the actual, they have to receive this inspection, but we've now corrected that. Our boiler system, our boilers unit has saw that error. So if you have anyone that's lived in these garden apartments that are considered condo. They're saying, why did I receive this notice for getting an inspection? Please just send it to us. We'll send it to them. They know that because these garden apartments are usually 1 or 2 family homes, they do not fall under it. That's how the Department of Finance has grouped them. They're unfortunately receiving these letters. That's what we have for DOD. Thank you.
Thank you, okay.
Can I have your name and contact information, please?
Yes.
Thank you, tell us all.
You have approach cards?
Yes.
Thank you.
Good morning, everyone. Kevin Morris, Queensborough Director for the Mayor's Community Affairs Unit. 2 very quick announcements. We just wanted to announce that some of you may have seen, but the mayor has joined with a coalition of 60 other mayors across this country to urge our new Speaker for the House of Representatives, Mike Johnson, to pass a bill on an assault weapons ban. This is becoming a serious issue across the country, and we just want to make sure that the federal government is taking this very seriously and taking safety on our streets very seriously. So we are joining the effort in trying to pass this ban. The other thing is that we have announced a, pull this up so I want to be wording correct on this. The mayor is joining with our GOT commissioner to take major steps in advancing our new Dining Out NYC, the nation's largest outdoor dining program. So it's going to be a set of proposed rules to offer clear guidance for restaurant owners, prioritizing equity, and expanding access to safe, clean, rat-free outdoor dining options across the 5 boroughs.
Yes, hi again.
Hello?
Thank you. When could we expect to see those in writing?
Writing?
New rules and regulations.
I will talk to the administration and see when we can get that.
Yeah, thank you.
No
Because we're already being asked from some of the people who've had sheds out there, et cetera, what exactly is, what does the future hold for them? Thank you.
Okay, thank you, Kevin. Seeing no more updates, right? Thank you all for attending today's Borough Cabinet. I also want to thank our staff here at the President's Office for putting this together. Thank you, Kalia. Our next Borough Cabinet meeting will be held on Tuesday, December 5th at 9:30 a.m. I want to say thank you and to everyone for coming out just one more time, and happy Thanksgiving. Stay safe and have a great rest of your day.